Welcome everyone to day 45. Day 45. I can't believe it's day 45 of our Vine Health COVID-19 pandemic updates. I hope you're all well and hope you're doing good. Thank you for sticking with me and allowing me bring you facts and not fiction about the coronavirus and to give you tips on how to not just survive this period, but also to thrive. We're all trying to make sure that we thrive, including myself. So it's basically us just supporting and helping each other through this time that we're in. So today we're going to again just catch up on what's happened the last 24 hours, and then we were going to talk about chloroquine and COVID-19, and if there's anything else coming out from the world of research about the cure for this pandemic and for the coronavirus, which seems to be quite a violent and aggressive virus which we need to tackle together. So what's happened in the last 24 hours? Well, if we start with the United Kingdom, our Prime Minister had a baby boy this morning, which is fantastic, which is good news for him, you know. Had a baby boy this morning, and his mother is healthy. Bearing in mind that they both had COVID-19, you know, they've gone through a lot during this time. But yes, they had a baby boy, so that's great. Well, also just to say that the number of deaths up until yesterday went up to 21,678, which is an increase of 586. Now, again, it went up more than I hoped for, because if you remember, the previous day was 360, but again, it's an average, so we'll keep observing that. I mean, there are some things that I don't think I've mentioned before, but I'm sure many people know. One of the things is about visa extension. So for those who are in the United Kingdom on a visa, and you are a frontline key worker, I'm sure you all know by now that you can get that extended for another year. So if you're a frontline key worker, so you're working as a teacher, social worker, a paramedic, you're a nurse, you're a doctor, and you're here on a visa, even if it's not just a tier 2 visa, and it expires before the 1st of October 2020, you can get that extended for you straight away. So just try and get that sorted if you're one of those. I think different employers are trying to identify those people, but just in case you're missed out, remember to go and do that. Interestingly, in the UK, there's people that are getting tired of the lockdown and are going out. When the police try to get them, they're coughing in the people's faces, which is really unacceptable behavior. So the police now need PPE as well. So the PPE issue continues as well. And again, so if you're one of those who is not obeying the social distancing rules and you're trying to hang out with your friend, please don't cough in the faces of the police. It's not their fault that this is still going on. Now, also British Airways, for many people, is their favorite airline. I'm sure you have all heard now that they're furloughing 12,000 of their staff. I feel so bad for the airlines because they are under so much pressure. Nobody's really flying anywhere. We're all desperate to resume flying again, but nobody's flying anywhere. And not only did Virgin ask for, I think they've asked for a loan, and now British Airways is sort of furloughing, keeping 12,000 of its staff at home and asking for government to pay their salaries, which is what furloughing basically means. Well, we really hope for an end to this, because this will completely grind the airline industry to a halt. And when things start again, it will take a while. It means that maybe plane tickets will be quite expensive when we all start flying again. But well, that's what's happened with British Airways. Also now with the US, you know, they're still trying to chase up the antibody testing, which is not very reliable. Antibody test just means that if you have had the coronavirus, even after you recovered, we will know. But the test that is available at the moment for everyone that needs it is the antigen test, meaning that if you actively have it right now, then you can get tested. But the antibody test will be so useful because then you can find out whether you've had it in the past, and you know, you don't have to worry so much. But that test is not yet very reliable. In the US, the deaths have gone up to almost 60,000 now, so 58,355 deaths in the US. Again, it just keeps going up and up. There's another clinical trial. I'll talk about that when I'm talking about chloroquine at the end, as to the clinical trial that is going on for COVID. But interestingly, in the United States, lots of malls are going to reopen this Friday. I'm sure they're going to put in social distancing rules, and maybe people wear face masks, but people are getting tired, so they're opening some of the malls this Friday in many states, including New York, I believe. They're going to open some malls. So you can go back to your retail shopping. For those people that like to go shopping, I can't bear going to the shops. I rather buy everything online, but the shops are going to reopen. But if you're going to go out in the US, particularly if you're black, you remember the black people are really very affected by this. Just make sure that you do everything you can to protect yourself. Face mask, anything you have to do. Let people look at you like you're funny. You know what you're doing. Just cover yourself properly. In Nigeria, the deaths have gone up to 44, so it's still not bad at all. And the total cases now at 1,532. And all the sort of the usual, is still going on. The economy is affected. The whole globe is suffering, apart from a few countries that have not been affected at all. And some of them that have recovered and are recovering quickly. Switzerland is doing quite well, New Zealand, Germany. There are many countries that are sort of really handling this really well, but we keep going. Now, so I was going to talk about chloroquine and sort of what's going on with that and what other research is going on. And I also wanted to talk to you, the people who I speak to who are not taking their medication regularly. We'll talk about that as well. So as you probably all know by now, chloroquine was a massive thing earlier on in this pandemic, and Donald Trump was saying, hey, chloroquine is going to order this truckload of chloroquine and give everybody, let us all try it because it's been shown to work. It doesn't work. Chloroquine, there's no evidence that it works at all. And in fact, it's actually caused more deaths since people have been trying it, because people that have heart problems are particularly sensitive to chloroquine. And so all of people that are getting chloroquine and taking it in their house, they've tried it, the scientists have worked on it, it doesn't work. So that's the evidence as of today. So if you're one of those that are stockpiling chloroquine, don't waste your time. It doesn't work. There's over 200 clinical trials of different things going on. And one of the other things that they're trying, the clinical trial that is starting is, the BCG vaccine that we all got, particularly if you're black, to prevent TB. There's been some talk about that helping to be like a vaccine for COVID. So the clinical trial for that is starting. No evidence yet, but everybody's rushing to try and find a solution to this horrible, horrible illness. And we can't wait, because until we can get a vaccine, there's no way we're all going to be able to go back to normal. So for if you know any sort of trials that are showing promise, please type it in the box. It will be great to know. I'm constantly looking at the clinical trials site, but there's been nothing that has shown. Oh, hello there. How are you? Thanks for tuning in. I really appreciate it. Up the Warrior Girls. Thank you. So like I don't think there's any clinical trial that's any particular trial that has shown massive promise yet with coronavirus. So we all have to really be very strict with our social distancing measures. So before I'll remind everybody about social distancing measures. Some people are using bleach. There's no need for bleach. There's no need for bleach. You're going to end up damaging your skin if you're using bleach to wash your hands or wash your legs. There's no need for that, but we'll talk about that. One thing that's been bothering me when I'm talking to patients, particularly black patients, is that I'm realizing that people are not taking their medicines regularly. So like things like for hypertension or for diabetes, people are taking it when they feel symptoms. That's the worst thing you can do to yourself. Please, 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 if you've been prescribed any medicine by your doctor, particularly blood pressure and diabetic medicine, please take it every single day. It's not only when you feel a headache. Or some people will tell me, oh, I felt my blood pressure going up, so I took the medicine. No, you're not supposed to feel your blood pressure going up before you take the medicine. Good morning, Daily. Thank you for watching. You're not hi Latif. You're not supposed to feel your blood pressure going up or you feel dizzy before you take your medicines. it needs to be regular, preferably around the same time every day. Don't miss it, because again, if you're, as I said yesterday or the other day, that when your health is optimum and is really, really in a good place, then you can fight things like viruses, all other viruses, not just coronavirus. There are other viruses in the around as well. But when you're fit, then you can fight that. So please take your medicines every day. And if you know anybody who's doing this, I feel my blood pressure rising, so I took my medicine, please tell them this is the most dangerous thing ever, because you don't want to suddenly develop if you are feeling a headache, that means that your blood pressure is so high that you're risking things like a heart attack, and you're risking a stroke. Or if you're waiting for your sugar to rise, then you're damaging all your organs in the process. So that's my general advice for today. Social distancing, the only help that we have at the moment is to have this very strict social distancing measures. So I'll say, make sure that you're washing your hands regularly. So I always sort of try and wash my hands every 2 hours or so, particularly if I'm not going anywhere. If I'm at work in an office, then I'm washing my hands a bit more frequently, every hour, and I'm putting hand cream on, because you don't want to damage the skin on your hands as well. I don't really like sanitizer, but people use it, because if I can get a sink and soap, I'd rather wash my hands than use a sanitizer. But if you don't have access to a sink and soap, then obviously use your hand sanitizer. So again, distance from people are walking past you, particularly in the supermarket. I always think that the risk in the supermarket is almost worse than the risk on the road, because people are just going past you. They're so close to you. If you can wear a mask, wear a mask. If you're going out shopping, wear a mask, wear a face cap if you can, because the whole idea is if somebody coughs, the closer they are, or they even that sort of thing, it's a projectile that transmits the virus out, and it travels quite a distance. So you want to keep a good distance from people as much as you can. And in the supermarket, people are fighting for things to pick up the shelves. They forget that, and they almost come in front of you. So keep that there. Be careful where you go, even with your shoes, your clothes. If you're a frontline worker, so many of us have resolved to wearing scrubs. Like I'm from here and I able to work at home and then also going to the office. No more house clothes, scrubs. If you're going out and you're not a frontline worker, maybe keep your out clothes to a few, so that you're not using all your nice clothes at this time. But the main thing is cover your face, because not only are you preventing yourself from getting it, if you actually have the virus, you're not giving other people. Because some people are very good, they get all sorts of viruses, but they never have any symptoms. We know there are people like that. They're just blessed. We don't know why, So that's all my advice for today. I really enjoy bringing this to you. I haven't been too diligent with my YouTube, but I'm going to try and transfer all the videos also to our YouTube channel as well, so that you can share that. Please share, like, follow, anything else you want. Let me know. Send your questions to the WhatsApp number that I shared before. If you don't have it and you want it, put a comment in the comment box. Just target Ask Vine Health, so that I know. I have so many social media platforms, not good, but I'm trying to organize myself. Or just pop your question on this page. If there's any question that you have, let me know, and we can sort of tackle that. But in summary today, chloroquine doesn't work. There's nothing that is proven to work. Trials are going on. All you can do is do your social distancing measures, and if you're on any regular medication, take it every single day. You guys, thank you for watching, and have a wonderful day, and I will see you tomorrow, day 46.